What is this? Glioblastoma. It's the most aggressive brain tumor. So glioblastoma multiforme is the most common and aggressive malignant brain tumor in adults. It arises from what? The astrocytes. It spreads rapidly and it has very, very poor prognosis. Right, the astrocytes is where it originates. Cerebral hemispheres, it often crosses the midline. The butterfly glioma can be referred to as, and also has pseudopallidated necrosis. So the tumor cells line up around the areas of necrosis, and also microvascular proliferation, so abnormal leaky vessels. High expression of VEGF as well. So edema, angiogenesis can be caused. Seizures, headache, especially at night, nausea, vomiting. Focal neurological defects. Again, this is all glioblastoma that we're talking about. Headache, seizure, focal. Okay, so 60-year-old, he's got seizures, worsening headaches, hemorrhagic, necrotic brain mass, he dies. What is it going to be? Glioblastoma multiforme. Rapid onset of neurological symptoms, mass effect, the shifting over. This is a brutal condition. And so glioblastoma multiforme, notorious for the infiltrative growth and vascular endothelial growth, fracture-driven edema. Metastasis, yeah, that's not going to metastasize. And it's kind of interesting how the most aggressive brain tumor in adults is not metastatic. But yeah, so we're just well circumscribed, located at the gray-white junction. And meningioma, I have a video on that. Extra axial, that's slow growing, dural based, well circumscribed. Oligodendrioma is a frontal lobe, calcified, slow growing, fried egg is what you think of, and the O kind of looks like an egg, so I think fried egg for that O. Primary CNS, that's going to be seen in immunocompromised, deep periventricular location, immunocompromised for this primary CNS, and schwannoma, hearing loss, and also the cerebellopontine angle, hearing loss, cranial nerve 8. You think about that one. So schwannoma associated with S100 stains. All right, hopefully this is helpful. There's your glioblastoma, very deadly, most common in adults. Metastasis to the brain, that would often resemble like a primary tumor. Meningiomas would be like oval cells forming the world pattern. Laminated calcifications with the psammoma bodies. Meningioma, psammoma. Just remember that. Glioblastomas, as we talked about, astrocytes, pseudopallidated necrosis, microvascular proliferation because of the VEGF. Oligodendrioma, fried egg appearance, chicken wire capillaries. Schwannoma, spindle-shaped swan cells. Yeah, so that's pretty much it for now. There are a couple of other things we could talk about, but not wanting to make this short too long. We'll see you in the next video.